Hi, my name is Dr. Perry Gadalovich, and in this video, I'm going to be reviewing the consent form for a Brazilian butt lift or butt augmentation using autologous fat. A Brazilian butt lift procedure is done under general anesthesia and lasts about 3 to 3.5 hours in two positions. We start on your back and we harvest fat from the abdomen, flanks, thighs, and then we turn you on your tummy and harvest fat from the back and the flanks and the posterior thighs in order to inject it into the buttock area. The procedure can take 3.5 hours, depending on how many areas we are liposuctioning. And the main risks are thrombophlebitis in the legs, which is a clot in the legs from the general anesthesia, which we give you a medication to prevent, and SOX, and nausea and vomiting from the general anesthesia, for which we'll give you some medication. For the surgery itself, there are very few complications, but it is important to note that in the literature, there is a complication described that is called fat embolus, where fat is injected into a large vessel in the butt and can travel to the heart and lungs and cause death. The risk of this is 1 in 3,000 and it is not negligible. I have never seen this or heard of it happening in Montreal, but it has been described and it is important to recognize. Otherwise, the risks of this surgery are fairly benign. It is the same as the risk from liposuction, meaning small contour deformities can occur in the areas where the fat is harvested and usually will even out over 6 months to a year. Skin laxity can also be a problem depending on the quality of your skin and how much fat is removed, and this is something that will be discussed with you during your consultation. In terms of the shape of the butt, this was have been discussed with you in your consultation, and the majority of our patients request a very natural augmentation and a nice curvature to the upper buttocks to give them a nice, pleasant silhouette. It is important to know that in the recovery from the Brazilian butt lift, you will not be able to sit on your butt for a whole month, and we will, in the post-operative videos, will give you some help in how to get around this in the first few weeks after surgery. One of the other things to mention is that when the fat is re-injected into the buttocks area, there is a risk that the fat can necrose. We've seen this only once in our patient population, but it can happen, and it is one of the reasons that we give you antibiotics to prevent it. It's also the reason that it's important not to sit on your buttocks because we want that fat to survive as much as possible. The percent of fat that we inject that survives is approximately 75%, but when you see your buttock for the first time, it's going to be very swollen. So the final result compared to the first day you see your butt is going to be a decrease of about 50%. A lot of the work that is done in the other areas of liposuction, however, compensate for this because they really help to shape the upper and lower butt and give you a more projected buttock. In the areas of the liposuction, you're for sure going to have some bruising and swelling, which is normal. And you can also have some changes in sensation, including some numbness, some tingling, and some burning sensations, which will decrease over the first 3 months. The other complication into the buttocks where the fat is injected is something called an oil cyst, where fat has died off and has been replaced by oil. I haven't had this happen yet, but it is a well-described complication of Brazilian butt lift.